IU Health and United Healthcare have reached a contract agreement after months of negotiations. During that time of uncertainty, many families across the area worried about losing their doctor. News 18's Brittany Tyner reports today's announcement was a big relief for one family in particular who was concerned they would lose the only doctors their son has ever known. Brittany?
Dan, after spending the first year of his life on life support under the care of IU Health doctors, the news that Oliver might have to change doctors hit hard for the Gilkison family. But today's news of a new contract agreement means Oliver can continue to move forward with the doctors who know him best.
Oh, say does that star-spangled banner yet wave.
5-year-old Oliver Gilkison has plenty of reasons to sing Thursday evening.
We're so excited because that meant we could keep these doctors.
Andrea's son Oliver spent the first 3 months of his life in ICU at Riley Hospital for Children in Indianapolis and 9 months on life support at their home in Tippecanoe County for a rare disease.
Oliver's is mitochondrial myopathy complex 1 deficiency. It's a progressive and degenerative disease that's neuromuscular.
Gilkison says during the first year, Oliver had to see several different doctors every other week. That has now changed to once every 6 months.
I really don't think we'd be where we are today without having those doctors in place.
Gilkison says because of the contract negotiations between IU Health and United Healthcare, Oliver's appointments at the beginning of this year were pushed back by 2 months. But the fear of losing their beloved doctors vanished Thursday with the announcement of a new 2-year contract agreement. The agreement allows 400,000 Indiana patients like the Gilkisons insured by United Healthcare to access health care through IU Health. The IU Health Arnett CEO Al Gatmaton says the new agreement means IU Health physicians and facilities are again in-network providers for United Healthcare insurance plans. He says the negotiations centered around payment terms.
If we don't achieve a level of quality and service that we've agreed to, we won't be paid the full amount. So we've agreed to be accountable for quality and safety and service.
No matter what the holdup was, Gilkison says her family can now move forward.
It's very important that we stick with the same doctor so that they can catch any kind of backslide or any kind of regression that he might be having.
Because they want to catch anything that would keep Oliver from being healthy and happy.
In the home of the brave.
News 18 had heard from one person insured by United Healthcare who actually switched healthcare providers and a couple of others who were in the process. A Franciscan St. Elizabeth Health spokeswoman told me today that they have no immediate way to tally how many United Healthcare patients they picked up during the negotiations. Brittany Tyner, News 18.